Welcome back to the Joust About Careers podcast. This is the place to learn about careers from the people who are actually doing the work every day. I'm your host, Brian Brott, and this week's guest is 2015 Van Buren graduate Brooke Klausing, who works as a nuclear medicine and PET CT technologist. In this episode, Brooke shares how she ended up in nuclear medicine when that wasn't even on her career radar in high school, the positives and challenges of her career, the importance of high school science classes, and much more. Whether you are interested in a career in nuclear medicine or are still exploring your options, I hope that what Brooke shares today will help all of you make better career decisions and have fulfilling career journeys. Enjoy the show. Welcome back to this episode of Joust About Careers. And Brooke, I appreciate you talking to us today. And I'd like to start by just asking you, how does a typical day look for a nuclear medicine technologist?
Usually there's a few techs and we have staggering starts. So the first one comes in, wake up all the cameras, essentially do all the QC, quality control, and check in all the doses. And then as you come in, you're greeted with your daily patients scheduled for the day, sorry. And just work with them. You might see them for 10 minutes. You might see them for 4 hours, kind of depending on what their doctor ordered. There's many different tests, not all dealing with cancer patients. You got some cardiac, general, nuke med, like your gallbladder scans and whatnot. And then it usually wraps up usually early afternoon. Then by 3:30, everyone's usually gone home.
So you talk a little bit about waking up cameras. What exactly do you do as a nuclear medicine technologist?
So what we do, it's kind of if you think about radiology in the sense of like CT and X-ray, the radiation exposure is coming from the machine to the person or through the person. Nuke med, we get certain doses calibrated for that patient at a specific time. We inject the radioactivity into the patients, and then there's little crystals in the scanner that pick up where that's coming from out of the patient's body. So we're looking at the physiology of the body more so than just the anatomy.
Okay. And when we talk about doses, you're talking about that radiation.
Yes.
Yes.
Yep. So they come in little lead cases. We call them pigs usually. So we'll get the pig. We'll start an IV depending on, again, the test ordered. Sometimes we put it in the radioactive eggs so we can trace the GI tract, or start an IV and inject it in them.
So you have a very important job as far as helping doctors diagnose what issues are, because you allow them to basically see inside that person's body and determine what the issues are. Now, how is this different from x-rays? I can also see inside the body with an x-ray.
Right.
How is this different?
So again, like x-ray, they shoot the picture, they take it. There's the patient's lungs, there's the patient's heart. They just see the picture. A part of nuke med is that PET CT. And so what we do is cancer cells metabolize sugar a lot faster than normal cells in the body. So by starving the patient for 6 hours, making sure their blood sugar is in the range it has to be, we inject a small amount of sugar solution that's attached to that radioactivity, inject it in them, let it circulate 45 minutes. And then when the radiologist is looking through the pictures, he's looking for any abnormal increases. So like the brain constantly using sugar to metabolize and function. So you're going to see the brain, you see the kidneys and bladder, because that's how it leaves your body, is through your urinary system. So they're looking for any abnormal if it's somewhere.
Right. So a lot of science in this.
Yeah.
And so when you were in high school, is this the route that you thought you were going to be taking for a career, or did you have other plans? And what led you then to nuclear medicine?
Oh no. I did not probably take all the science courses I needed in high school. For one, physics.
Mhm.
um, I was graduated Van Buren and thinking finance all the way, but I sat through some finance courses in college and was bored out of my mind. I'll just put that out there. And so I talked to this lady on campus, and she was giving me kind of ideas. And I was a candy striper all throughout high school, so I was like, I kind of liked the healthcare side. Didn't really want to be a nurse though. And so then she brought up nuke med and went and talked to the professors, and I was like, oh, that sounds pretty interesting. Let's give it a shot. So that's kind of how I found it.
Well, and I think what you said there is you were a candy striper for a while. So that experience is what helped you to determine, wow, I kind of like that. And I try
Mm-hmm.
to reinforce to students all the time, go get experiences because it's either going to be an experience like you had in finance class and you realize, ooh, this isn't for me. Or as a candy striper, realize, wow, I do kind of like this. And then obviously, once you say healthcare, then there are all kinds of different
Absolutely.
opportunities. So you said you didn't want to be a nurse. Um, I guess, was there anything else that you considered in the healthcare field, or was it nuclear medicine from the start?
I considered physical therapy, but that I don't know if that just essentially intimidated me at the time, or I didn't want to
Okay,
put 6 years into it.
right.
Um, that kind of thing. So it was kind of a flop between both. And then I looked at the courses that you would have to take for physical therapy and the courses I took for nuke med, and yep, picked
Okay.
nuke med.
Yeah, and they both allow you to be in the healthcare field. So either
Mm-hmm.
way, it was going to work out. As you think about your degree, so it sounds like you need a 4 year degree for nuclear medicine.
Yeah, so what we did is the first 3 years you're working on your bachelor's of science, and then that third year you apply to nuke med or NMT, and NMI Institute is what they called it. You apply for NMI Institute, and then that fourth year you have your first fall semester, as you will, and it's your course load. And then the second spring and summer semesters, you do your clinical hours. So the whole NMI program is just a year.
Okay. Now you went back to get your master's degree in health informatics. What did that do for your career? And is that the type of master's degree that a lot of nuclear medicine people go and get, or are there other options or certifications? Tell us a little bit about that.
You absolutely can go back. I don't need my master's degree to work where I'm working now. It was more so my mom works at a college and I want to keep taking classes.
Mm-hmm.
Um, I learned a little bit more of the IT informatics side of it, so I might like help the department build up our different protocols in Epic and the computer. I've done that before, but really I don't need my master's. Um, I did do on the job training and I have my CT license as well. Again, I don't really need that for nuke med degree to work at a hospital to do PET CT, but I just kind of was like, all right, let's go.
Right, right. Well, like you said, if your mom works at the university and you can get the classes cheaply for
Mhm.
free, whatever, um, it's tough not to take advantage of that. And
Absolutely.
again, who knows where down the road that degree could be useful to you.
Mm-hmm.
And if you could get it really cheaply, then that's definitely the way to do that. Now, is there a lot of demand in the field for nuclear medicine and PET CT and all of that? Are the jobs pretty plentiful, or are they more
Um,
difficult to find?
when I graduated college, it was harder to find a full-time nuke med job here in Ohio. So I was over in Indiana for a few years. But right now it seems like after COVID, there's nuke med jobs almost anywhere in Ohio. And it's definitely continuing to grow because there's a lot more isotopes, which is just the radioactivity that we inject in people, different ones. They're coming on. There's more and more coming to market for different types of cancer, more generalized cancer, like FDG. dose is a very common one. It's kind of the main one you look at. But if you break it down, there's more dedicated specifically for like prostate, specifically for like neuroendocrine tumors. And then a lot of those are kind of more and more isotopes again as well are being produced for not only like diagnostic, the imaging, but therapy as well. So they're definitely working, definitely growing. And like I said, there's a lot more opportunities in Ohio now with full-time nuke med jobs.
And it sounds like they're going to be a lot of jobs for a long time because they're constantly making improvements, and that means you're going to
Mm-hmm.
be learning more. And so a little bit of job security there.
Mm-hmm.
Are there any fields in healthcare that maybe high school students just don't think about? Because again, I'm sure you didn't think at all about nuclear medicine when you were in
Mm-mm.
high school. Are there things that you've seen now that you're in the healthcare field and you say, wow, I bet, you know, less than 1% of high school students are even aware that this type of career is available? Can you think of anything like that that maybe you could share?
I just kind of want to use the whole umbrella as in like radiology. Like not once did I think about like X-ray, CT, MRI, ultrasound. And there's constantly jobs, there's a need for it. Once almost every patient either seen in the ER is going to get one of their tests, one of those tests ordered or studied or
Right,
whatnot. So there's definitely a need for radiology jobs in general.
right. Do most nuclear med people, do they typically work in a hospital? Is there much that's, out in a doctor's office, or is it pretty much always in a hospital?
Nuke med, not necessarily. The job I'm at currently, I work out of a mobile truck,
Oh,
part time. So it's PET CT, and we travel to different smaller hospitals that essentially don't have a full time PET CT scanner on site.
okay. So that's something you can throw in a truck and go
Yep.
do it. Okay. Well, that's interesting. Very cool. So, as you think about some of the more challenging aspects of this career and some of the really positive aspects of this career, can you share what some of those are and maybe why you're willing to put up with those challenging aspects? And that probably has to do with the positive aspects of the career.
Yeah. One thing that I don't necessarily care for is call. If you work at a hospital, you're going to take call, you have a pager and whatnot. Um, which let's give or take. Like I don't have to go in for holidays. I'm not scheduled for weekends. You just rotate call, which is kind of 50-50. One of the rewarding sides of it is a lot of these patients I see sometimes every 3 to 4 months. And you see that their treatments are working and you see them getting better and better. And that's always rewarding because, I mean, one, they're obviously getting better, but two, you've established a rapport with these people. So they know you, you know them, that kind of thing. It's always good to see them again.
Right. Yeah, building those relationships is definitely something that is positive. I'm sure there's also, though, potentially the negatives there that
Yeah.
do you have to give the bad news?
No,
No. Okay. So that's a
no.
doctor that's doing that. You're
Yeah.
obviously communicating with the radiologists, the doctors, et
Mm-hmm.
cetera. Okay.
Yep. The
Okay.
radiologist is the one that reads it and then their doctor gives them the report. I can't do or say anything along those lines.
Right.
I
Right.
just treat the patient like I would with all of them.
Yep. Yep. Now, if there were one or two pieces of advice that you would have for people considering going into the healthcare field, what would that advice be?
Say one, probably take some more science courses in high school. Physics was rough for me in college. But also always keep going. There's definitely a need for you out there in healthcare. People are constantly getting older, getting sick, whatnot. They need you. They need that empathy that you can offer for them. And it's in turn a rewarding career.
Right. Now, physics. I'm no scientist myself by any means. I guess I would think chemistry, biology, those would be the big things. Physics. Why is physics so important in a job like this?
I guess chemistry is too, don't get me wrong, but that was always easier for me. It just kind of clicked.
Okay.
Anatomy, yes, I had to study, but I just remember my physics courses in college and they were everything I could do to get by, maybe just because I didn't have that like base level from earlier on.
Yeah. So, high school students out there, if you are considering a healthcare career, get as much science. And again, even if it's something like physics that you say, well, I would never use that. Well, you might. Or you
Yep.
might have to take college classes in it. So, okay, good advice. As we wrap up and as you think about everything you've learned since you graduated from high school, what's the big thing that you know today about careers that you wish you had known when you were in high school?
You never know what your degree, what your education or whatnot, where it's going to take you. There's so many different people out there working in different lines of work, if you will, that don't necessarily have that background. Like I know a lot of people working in the IT department, they have their history degree, but then they go in and they have all this experience, and they're some of the most helpful people when you're trying to set up your workstation or whatnot. Um, so you never know where your education, experience, and whatnot could take you.
Perfect advice, Brooke. Really appreciate it. I hope that we've opened some eyes to what nuclear medicine could look like as a career for some people. I hope that they'll reach out to you with questions if they have any. But thank you very much and good luck on your career journey.
Absolutely. Thank you.
If you liked this Joust About Careers episode, you can explore previous episodes and highlights to learn about even more careers of Van Buren graduates. To be sure you don't miss upcoming episodes, please click subscribe on YouTube or your favorite podcast platform so you'll know when the next episode is released. Thank you for spending a portion of your day with us, and we hope you will continue to prepare for your future by learning just about careers.